All right, welcome. Today we're going to decode one of the most time-sensitive medical emergencies there is, a heart attack. We're going to break down what's really happening, what you need to look for, and why those first 15 minutes are so unbelievably critical.
Okay, let's just dive right in with a question that honestly could save a life. How do you know when that feeling in your chest is just, something you can brush off versus a full-blown medical emergency that you need to act on like right now? So, to really get what's going on during a heart attack, you have to understand the basic problem. And it's really all about supply and demand. But we're not talking about economics, we're talking about the blood your heart muscle needs to survive.
The fancy medical term for this whole situation is acute coronary syndrome, or ACS. And all that means is that the supply of blood, which carries all the oxygen, can't meet the heart's demand. Your heart is a muscle that is always working, and when its fuel line gets choked off, it starts screaming for help.
I love this analogy because it's just so perfect for explaining what's going on. Think of ischemia as a sudden, massive traffic jam in your heart's arteries. Blood flow slows to a crawl, the heart muscle is starving, and it starts to hurt. But if you don't clear that jam, it turns into an infarct. That's a permanent roadblock. And now part of the heart muscle is literally starting to die. That's the myocardial infarction, what we all call a heart attack.
All right, so we get the what. Now let's talk about the how. How do you recognize this is happening? Because spotting the problem is the first, most critical step. And spoiler alert, it is not always the dramatic chest-clutching scene you see in the movies.
Yeah, the classic one everyone knows is that chest pain or pressure, usually on the left side. But look at this whole list. That pain can shoot up to your jaw, your shoulder, your arm. You might feel like you just can't catch your breath, feel sick to your stomach, or break out in a cold sweat. It's a whole spectrum of signals your body might be sending.
And this is maybe one of the most important things to get. We all have this image of the movie heart attack, right? The person clutching their chest, falling over. But look at the other column. It could just be feeling incredibly, overwhelmingly tired, or nauseous, or maybe just some weird pain in your back or jaw with no chest pain at all. And that could still be a major heart attack happening. So you've got these symptoms. How seriously do you take them? Well, that's where risk factors come in. If you're over 45, have diabetes, you smoke, got high blood pressure, any of that stuff, and especially if there's a family history, the more of those boxes you check, the higher your suspicion needs to be that what you're feeling is your heart.
Okay, so when all the signs point to something serious, the whole game changes. It becomes this frantic race against the clock. And that race is all about one specific diagnosis that changes absolutely everything: a STEMI.
A STEMI. Yeah, that's the big one. This means one of the main arteries feeding your heart is completely 100% blocked. You can only see this with an ECG. And when paramedics see that specific pattern on the screen, it's like a 5-alarm fire. It kicks off a special high-speed protocol because every single second that artery is blocked, more of the heart muscle is dying, period. And this timeline, wow, it just shows you how insane the urgency is. Get an ECG and send it to the hospital within 5 minutes of arriving. Tell the hospital a STEMI is coming within 10 minutes. And get this, the total time they want to be on scene, under 15 minutes. It is all about getting you from where you are to that cath lab where they can open up the blockage. It's an absolute blur. So what are the paramedics actually doing in that tiny 15-minute window on scene? I mean, besides just flooring it to the hospital, what can they do right then and there?
This is fascinating. So they have a few key meds. Nitroglycerin helps with the pain by opening up blood vessels. Morphine, well, that's for serious pain relief. But look at that last column. Do they improve survival? Nope, neither of them. There's only one drug on this list that has been proven to actually help you survive, and that's aspirin.
Just let that sink in. Besides getting to the hospital fast, a simple, cheap aspirin is the only thing given in the field that has been proven to save your life. It's incredible. It works by making your blood platelets less sticky, so it helps stop that clot from getting any bigger. Okay, but let's circle back to nitroglycerin for a second. While it's great for that chest pain, it comes with a huge warning, a really critical one that everyone should know about. And this is a major safety issue. You never give nitroglycerin to someone who's recently taken medication for erectile dysfunction, like Viagra or Cialis. Seriously, never. Both drugs open up your blood vessels, and if you take them together, your blood pressure can just completely bottom out. It's a life-threatening combination. All right, that was a ton of information, from the what to the why to the how.
So let's just boil it all down to the key things you absolutely need to walk away with.
It really just comes down to these 4 things. Number 1, recognize that the symptoms can be all over the place, not just what you see in the movies. 2, call for help right away. Don't wait. Don't try to tough it out. 3, understand that time is muscle isn't just a saying. It's the absolute truth here. And 4, remember that an early aspirin given by the pros saves lives.
And that really leaves us with one final crucial question. After hearing all this, knowing the weird symptoms, understanding the risks, knowing what happens in those first few minutes, could you spot the signs in time for yourself or for someone you love? Because honestly, knowing the answer to that question could truly change everything.